Well, good evening, everybody. This is your Reinvent Coach, 𝐷𝐞𝐢𝐧𝐰 𝐻𝐻𝐿𝐴, and welcome to Reinvent the Mental Health Challenge. I am so excited. Today's guest is one of the champions in the mental health fraternity or field. She is a medical doctor and she's forever developing herself. We'll ask her about her graduation. She was just graduating recently. So I'm super excited to have her here. Let me bring her on. Let me bring Dr. Faith on. Hi. Faith, how are you?
I'm good. How are you?
I am good. Welcome. I wanted to do the introductions and just welcome everyone while you are here because I see you are early. You've been waiting in the lobby for quite some time. So thank you. Well, guys, welcome again. As I said, I have Dr. Faith Mahlangu with us today. She is a mental health advocate. She is a champion in the field. She's a medical doctor. And you know what? She's doing great work. I think one of the work that impresses me the most with what she's doing is that she went beyond helping women and everyone in a space to focusing also on helping men. And we'll talk about why that is important for her and why that is so significant. She just had a podcast before she came here, Mental Conversations. So thank you so much for honoring this invite, even though you had your own session yourself. And yeah, thank you so much for joining us.
Hi, 𝐷𝐞𝐢𝐧. Thank you so much for having me. I you know, I'm just such a fan of your work. So I'm so happy that you've given me this platform. I'm so honored to be able to serve your community, to be able to speak about mental health. I'm happy that we've been given these platforms so we can engage on this subject. And yes, you're right. I'm busy with mental health advocacy. I'm a medical doctor, and for me, my heart is wellness. It's mental health. So I'm so happy to be here.
Well, we are happy to have you. We are happy to have you. Guys, please do me a favor. Do say hi and tell us where you're watching from. Like Mrs. Lebogang, Mrs. Lebelwani, thank you so much for joining us. We really appreciate you. And I think the simplest and free thing you can do for us is to share this broadcast. Like it, share it. Because as you've seen yesterday, there was so much healing, there was so much learning. And we believe that we need to pay it forward by sharing these broadcasts to other people. Before we get into a lot of details, someone just joined now. I saw there was an addition to the numbers that are watching. If someone just joined us now, what would you say they need to stay? Why should they stay and watch this whole broadcast?
So obviously, I am here to challenge the perceptions people have of mental illness and mental health. I am in the mental health space. I work in psychiatry. I see it every single day. And I know that people don't really have access to a lot of information. There's a lot of information out there, but there's not a lot of truth. And people struggle with being able to know what truth is and what is not. And that's what I'm here for. So it's a platform for you to be able to ask, a platform for you to be able to take ownership of your own mental health and to start interrogating, because a lot of people are struggling and they do not know how to identify it. So that's what today is about. And most importantly for me, it's about you. We all have roles that we go up for. You're maybe a professional, you're a mother, you're a father, you're a girlfriend. But a lot of that takes a lot of our time, and we struggle with being able to focus on ourselves. And then we find ourselves then having adverse outcomes. So that's what today is about. It's about you being able to focus on you, saying that you are a priority, your health is a priority, your wellness is a priority. And I'm here to give you the tools to identify how to empower yourself and take care of yourself, so you don't find yourself dealing with complications of mental illness.
Sure. Wow. I can't wait for you to challenge, those misconceptions, those myths, and give us the truth. I know why I should be listening to you. I know why I invited you. But for someone that doesn't know you, share a little bit why it is important that they listen to you today.
Okay, so like I said, I am a medical doctor. So I work in a psychiatric facility where we see both males, we see both males and females. We've recently started seeing some kids as well. So I have quite a lot of experience in psychiatry. We're a designated psychiatric unit in Mpumalanga, so we're a referral hospital. So anyone outside, they discuss with us, and then we also help them to manage those patients. And then I also just recently acquired my diploma in mental health. So that's essentially telling you, it's my baby, it's my bread and butter.
Your field. Sure.
It's my field,
Wow.
so just acquired, because I'm wanting to equip myself more so I can better serve you. It's not going to stop there. I'm going to continue, studying. So essentially it's me saying that I spend my time acquiring skills so that I can serve you. And therefore come and join so that you can be able to be equipped. I think for me, it's about equipping you with tools so that you don't find yourself having to be diagnosed, and even if you are diagnosed, you don't find yourself having to deal with complications that were other. And I'm someone who's identifying that it's hard sometimes to get to a doctor, and therefore I've come out of the hospital to come and answer whatever you may have, to give you whatever you need.
Yeah. Wow. Thank you so much. Thank you so much for that. Now, apart from why we should listen to you, we'd like to get to know you a little bit. You do mention that you were graduating, and I think it was yesterday, or I saw the pictures yesterday. So tell us, who is Faith? Where does she come from? And how did you develop your passion for mental health?
Okay, so faith is a I'm a lover, I'm a servant. I think my natural being is to just nurture, and that's who I was there growing up. It was always in me to just serve. I always found myself being attracted to people who were broken, and it's something that it happens subconsciously. I was always, if someone is struggling, I want to be there to help them feel better or to give them hope. So that was always me, and that's essentially, what encompasses who I am. In terms of deciding to then be interested in medicine and then eventually going into mental health, I think mental health chose me before I realized that it was choosing me. As a young child, I was always very fascinated in mental pathology. So I'd be interested in the people. Like, when people shine, they're like, I'm there because I want to know, but also because I find value in that. You're a human being. What is it that's making you struggle? So I'd often find myself befriending people who other people would shun. And already then I see that the seeds were there. And then when I decided that I want to go into medicine, it was actually, I knew that I was interested in the brain and I was interested in helping people. And then it slowly came together where I was like, okay, psychiatry. Okay, if I like psychiatry, I need to become a doctor. And that's actually how I got into medicine. So already getting into medicine, I knew that mental health was something, and it shaped. And as I continued to interact with patients, I always knew it was always the one that had me, even when I tried to get away, it always pulled me in. And eventually I found myself here. I eventually decided that I'm committing, and this is where we are. And I tell you, Vusi, it's the most natural thing for me in any space. I think anytime I interact with someone, I'm just like, but are you well? But do you realize that you are important too? So for me, natural thing. And hence, even with the graduation, even with the furthering of my studies, it's only the natural progression of me, essentially who I am. And I think in a nutshell is I'm a nurturer. I care, I'm a servant, and I just want to see people becoming who they can be when they're well. And that's what I've dedicated my life to do.
Wow. That's so amazing. That's so amazing. And we are so happy that you are here and you are giving us your time to serve us and to help us in this space. So you mentioned earlier that there are a lot of misconceptions and you'd love to offer some truth. Maybe the first truth I'd like to really deal with is, what is mental health? And how do we maybe see if someone needs intervention or someone's not well mentally?
Okay. So that's actually a very, very important question, and something that people really struggle with, especially when we diagnose them. Because the moment I diagnose you as a person who's struggling with a mental illness, people automatically become very resistant to that, because the thought is, no, but nyashanya, and that perception then prolongs people's illness to the point where it becomes more difficult to treat them. So hence mental health. So people think Uguti, health is when if you don't have disease, then you are healthy, and it's not that.
Sure.
WHO definition does say that it's not merely the absence of disease or infirmity, but it's actually well-being, and it's various aspects of your life. So it's your physical, right? It's your mental, it's your social, right? There's so much value in the way that you're able to interact with yourself, with your relationship, with the people around you. And I took a definition of well-being from psychology, and it says how people feel and how they function both on personal and social level, and how they evaluate their lives as a whole. And then it further goes to speak about certain avenues, which is emotion, behavior, cognition, and relationship. We know what emotion is, which is the way we express ourselves. We know about behavior. Cognition is our ability to plan, our ability to understand, our ability to concentrate. So the moment you start seeing an impairment there may be a problem. and then finally relationships, right? And then that's where I want us to focus on. I want us to focus on these avenues. So being emotion, right? You asked me, how can a person start identifying that maybe there's a problem? Is now emotions are generally, we have emotions as people, right? They're a normal experience, but there comes a point where they become pathological, which is where it's not healthy. So there's sadness. I'm going to give an example of sadness, right? We get sad. It happens. It's a normal thing. But now when you find that you're constantly sad, so most of your day is filled with sad emotions. In your being sad, you don't want to do anything that you used to previously enjoy. In your being sad, whenever people come and try to cheer you up, you're unable to find that already is communicating to you that, wait, something is wrong. We then look at anxiety. Anxiousness is normal. I was anxious coming into this. It's normal to normal feeling. But then there comes a point where you're no longer able to function in certain spaces. It impairs your ability to show up. If you go to work, you now struggle. It paralyzes you. There comes a point where that anxiety prevents you from being able to show up or from being able to be. That's when you start, something's wrong. But also, if now most of your day is filled with anxiety, that's a problem, because anxiety is there to be shortened. It's a normal human response. But now, if every day, most of the day, you're starting to find yourself more anxious than usual, that's when you start thinking, right? I want to also mention anger. So anger is normal, okay? It's okay to be angry. But now you find certain people whose baseline is anger, and they say, yeah, this is who I am. And I'm here to say, but anger is not our baseline. Anger, it causes a certain physiological response. Automatically, you're going to hyperventilate. Your heart is going to beat fast. You're going to, it's a stress response. So if now that's your baseline, imagine that your body has not been created to function in that. So automatically something's wrong if that's how you constantly are. So when you start seeing that your emotions are impaired, or they're beyond what they usually are, that's when you should start being suspicious that maybe my mental health is suffering. I want to go to behavior. So behaviors are very important. Behavior, we look at substances. So people can have a cigarette, right? I'm not saying cigarettes not good, but I mean, then let's say you were smoking 1 or 2 cigarettes, and now you're finding yourself smoking more than usual. We look at drinking. You can have a glass of wine, but people who now start, the moment you find that you're stressed, you now need to have that drink. The moment you wake up in the morning, you now need to drink. That's now a shift in your behavior. Right? The way we look at your sleeping. So now you're struggling with sleep. People have normalized not being able to sleep. We say, no, it's fine. I'm going to get into bed. I'll fall asleep after 2 hours. That's not how it's meant to be. So that's communicating that I'm not okay. I want to go to cognition. Cognition, as I said, is the way you process things. So if now you're starting to find that you struggle to concentrate, you find that you've been given a task and you're not able to fulfill it the way that you're supposed to, there's a problem with your concentration and your attention. What about your memory? You're starting to find yourself a bit more forgetful than you used to be. Those things, your mind is communicating. If you were able to, let's say you were able to do certain calculations, and in this specific period in your life, you can't plan. People are becoming a bit more unreliable. It's communicating that something is wrong. And then finally, relationships. We tend to be okay with dysfunction in our relationships because we say, oh, it's normal, but it's not. We're meant to be able to be in relationships. Yes, there'll be conflict, but not function. So if now you're finding that you're having conflict everywhere you go, if you find that you're forming unhealthy attachments, so yes, you're getting into relationships, but you're now getting into unhealthy relationships where without this person you cannot live. That's communicating that something is wrong. Could it have been something that took place in my childhood that I'm now emulating currently? Could it be something that I have not dealt with? So already those little things are communicating that I am not well. And I just want to say that a lot of times people wait to be diagnosed with a mental illness before they're able to say, I'm mentally unwell. But remember, to go back to our definition, it's not just the absence of disease. or infirmity, the moment you find that these areas of your life are being impacted, that's now communicating that I'm not well. So you shouldn't then wait for it to get to a point where it's a disorder, but you should be able to identify that, okay,
Sure.
this area is affected and therefore I need to take steps.
Yeah. Wow. Sure. You've just shifted my mindset, from looking at sickness and disease and using that as a baseline to say maybe I am not well mentally, to say no, it's not just the absence of or the presence of sickness. It is rather even when you are not functioning well, cognitively, relationally, and we know when we are not functioning well. We know when we are struggling to sleep. And when you spoke about that struggling to sleep and you said, we've normalized it. I think of how most of us these days have normalized driving a car with an engine light, there on the dashboard. And you are saying, oh, that's okay, it drives until someday it stops and it needs either an engine overhaul or something. And I'm feeling like you are talking to us and saying the same thing and saying, look, there is an engine light. It could be your sleep. It could be your relationships. And you are waiting for the whole car to stop for you to be diagnosed. And then that's when you say you are mentally sick. But this thing really starts small. And I think it starts so small that maybe sometimes it's very easy for us to miss it. Do you think we miss it, or we ignore it, or we are not informed? What, from your experience, people that end up in your clinic or in the spaces where you work, were they ignoring it or they just didn't know? What's our main challenge?
So it's actually all of that. So the first one being not knowing. So a lot of times people, like we said, we normalize this engine light, but you don't know what the engine light is communicating. You don't know that your body is saying, I'm struggling, because this has been your baseline. A lot of people have grown up and they know themselves to be angry. They know themselves to have these pains every once in a while. They know themselves to not sleep, and that's fine. So not knowing is a big one. And part of not knowing is not knowing what mental illness is. So, like I said, people think that mental illness is hearing voices, which is a part of it. We have diagnoses, which cater to that, but it's so broad, and if you do not know that, then you cannot take the steps to seek help. So firstly, it's the knowledge. Secondly, you have the ones who know, but there's denial. And denial is, I know, but I'll be fine, or it can't be me. It can't be me. I'm weak. I'm not weak. So therefore, I will not accept myself to be struggling. And this is something that a lot of high performers then struggle with, because I know myself to be able to perform. I know myself to show up. Now I'm starting to identify this about myself, and therefore I can't, because if I'm able to conquer every other area in my life, surely this I can as well. And therefore I'm going to deny the impact that it's having on me. Instead, I'm going to mask it until it can't be masked again.
Sure.
And then finally, fear. I've noticed that a lot of people may identify, they're able to know things, and some of them maybe not in denial, but the fear of accessing, fear of, if I go and I see a doctor, they're going to label me. And it's important for us to acknowledge the stigma that still exists around with the mental illness. It's something that we're working towards. That's why such platforms are so important. But the world that we live in makes it very difficult. I see it where people, the moment they have a mental illness, they struggle with relationships because people label, they struggle with accessing healthcare. So it's that fear of, but now that I go and I look for help, and then you're going to say that this about me, and now what? Fear of the clinical process. People are scared. People are not trusting of the clinical process because of the damage that is caused to them, maybe also other family members. And therefore, although they see, they're afraid of going into the space. If you have therapy, people are very afraid. I don't trust. How can I trust a person with me? So those are the things. It's multifactorial. You could have people who have one of these. You could have people who have all of them in one, and then it cripples them, which prolongs them being able to access proper care, resulting in complications.
And what's the worst that could happen if someone, whether it's denial or it's fear or it's lack of knowledge, what's the worst case if I just don't deal with it? You know, what then happens? Does it compound, and what could happen? And I know each case might be different, but generally speaking.
So it's very important then for people to be aware of that. So in the world, I'm happy that the world is finally acknowledging mental illness. We people seem to think that, you know, you can think yourself out of it, but you know, the brain and the mind, it's an organ, and if it's ignored, I can tell you that it's not going to disappear. It's going to compound, as what you've said. You know, it does compound, it complicates. So you may find yourself initially struggling with sadness. Maybe you'll be sad every once in a while, and because you're not dealing with that symptom, it slowly becomes every day, most days, and eventually you find yourself then getting diagnosed with the depressive disorder. Now you're finding that you're not able, it's not just sadness that you're dealing with. Now you're dealing with not having any energy to show up for anything, not wanting to isolate yourself, not wanting to be with people. People do not know that depression can actually affect your memory. So you may actually get to a point where it looks like dementia. That's how it can look like. Your memory can be so impaired that you're a person who's unable to remember things just because you let it grow. So each psychiatric illness can eventually complicate, and it can also compound. So you may, if you ignore depression, for example, you could then find another comorbidity, which is now anxiety. So now you're struggling with depression and anxiety. If you're ignoring anxiety, it's there. So what happens is you're trying to cope. So what happens? You now develop a use disorder, so an addiction. Maybe you start using alcohol to cope. So it compounds. One of the things that can take place, a person can be anxious, they smoke weed, and then one of the complications of weed is you start hearing voices. Right? Why? Because you neglected this one aspect, which then adds. So you can find yourself being a person who was initially would have been diagnosed with one mental disorder. You would have put on treatment for a certain period of time, and now you're a person who's got a multitude of disorders and is having to be managed in a more complicated environment as well. So hence, it's so important to be proactive. The moment you start identifying, take the step, because the body will find a way of communicating. And there are times where, by the time it communicates, it's not great. Vuti, I'll tell you that I've had patients who were high performing, have been great in their fields, were in executive positions, but because they ignored, got to a point where we're having to write grants for them. They're no longer able to, where they're having to just be on incapacity leave. Some of them are unable to be hired anymore because they're so incredibly impaired. And when you look, it's something that started as anxiety, or something that started as a depression that eventually became to a point where there's not much that can be done about it. So I really encourage being proactive and not allowing the prejudices and the stigma to discourage you from accessing help, because it's so important for you to get that healthcare, for you to get that help. We are here and we are equipped to be able to help you so that you can go back. Being diagnosed with mental illness does not mean that you're now sentenced to dysfunction. It just means that your brain is struggling, your nervous system is struggling, your mind is struggling, and you need clinicians to help you to get back to baseline.
Sure. Wow, Faith, you know, when you spoke about, it's like they invite each other, right? And you said something that you now have a multitude, you know, that word hit me. A multitude of dysfunction. Let's just wait for for Faith. I think she's okay. You're back. Yeah, and you said you now have a multitude of dysfunction. That really hit when something could have been sorted as a one thing, but it now has cousins and half sisters and brothers, and that's a lot. That's a lot. But you also keep mentioning stigmas and stereotypes that cause fears. You know, growing up, I used to hear that 𝐖𝐭𝐡, for example, that cancer is only for white people. And then you hear that indoda, you know, 𝐖𝐤𝐴NYI doesn't get affected. 𝐖𝐤𝐴NYI is the worst case, but indoda doesn't get affected by such things. Why are you seeing a counselor that is like a shrink? It's a white thing, you know? And what are some of these stigmas? And I don't want to make this about Black African people, but hey, majority of the people that watch, we are a Black African community. So what are some of our stigmas and myths and misconceptions and lies, you know, that keep us dying? And I think so many people now we are seeing they commit suicide. And I think generally because there's so much stigmas and fears that we find it too late.
So important for us to address as a community.
Sure.
And because it's so rife and it really prolongs our ability to access mental health care. And then it also results in us seeing such things as suicide, which a lot of times may have been preventable if the language that we use about it, the perceptions that we have about mental illness were actually, you know, were redirected and then were cleansed, you know, because so one of the big ones that I identify is the language 𝐑𝐞𝐢𝐭𝐡. So there's a lot of negative connotations around that. It's something that I grew up around, something that I used growing up as well. It's something that's still said. The moment, you know, bona umuntu doing this or a person doing something out of the ordinary situation, then we see people walking in the street, you know, we grew up seeing them carrying bags, carrying this, and we say bash. So automatically there's a negative connotation associated. So the moment now you go to a psychiatric facility, it's known as 𝐼𝐸HLELA SaMahlanya.
Yes, true.
Yes. So are you going to now want to go there? No, because what are your thoughts? I'm not crazy. The moment someone is going to say to you that you have a mental illness, you're going to say, but angihlanye. And it's something I hear all the time. So for me, as a community, I want us to challenge our language. And even though there was a point here where we used to, you know, we say, there needs to come a point where we say, but what does it mean when we're saying that? Are we not excluding the next person who has been diagnosed? Are we not discouraging them from seeking health care, from continuing with their medication? And what are we saying about our rights to access mental health care if we're going to label people who struggle with mental illness as a 𝐸𝐻lanya? So even with English, I don't prefer crazy. I always say to my patients as well, you're not crazy. You are not well, right? The same way that if we are khohlela, if you're coughing, if you have pain, you're not going to call yourself crazy because your chest is now struggling. You're not going to call your leg crazy. So why do you call your mind crazy when it's not well? So I think that's the one thing is if we can change and challenge the language that we use around mental illness to say that it's not being well and not craziness. So essentially that's that. The next one is the witchcraft. That's a big one. So the moment people are diagnosed with mental illness, they struggle to accept because they say, no, 𝐼𝐸𝐻lanya. And
yes.
Am I disputing people's beliefs? I'm not in any way doing that. But it's important to also recognize that mental illness is a very real thing. And it doesn't mean that you've done anything wrong. It doesn't mean that you have failed in any way. And it doesn't mean anyone has done anything to you. It's the same as any other organ in your body. If you have how many of us, if you have diarrhea, for instance, you're not going to say, oh, bangiloile. That's not your first go-to. So why again, when it comes to mental illness, which is an organ, it's the brain, why do we then want to attach it to that? So to demystify that as well, a person who's struggling with a mental illness is a person who has a certain dysfunction in an organ in their body, and therefore there's medication to help them with that. Some of them are able to go back to baseline, others are not. Why? Because it's the nature of their mental illness. It's not because they've failed, it's not because they have bewitched, but certain structures, there's certain connections in the brain that didn't work well, and it's not their fault. Another one that I see, and the reason I want to mention this is because a lot of parents sit on their kids until it's too late, thinking that children do not get mental illness. So we think that if a child in Mhlawumbe has been exposed to something traumatic, if a child is there's certain things that they have experienced, if they've experienced bullying, if they saw you as parents maybe fighting, if they've experienced change, let's say changed environments, we tend to think that children cannot be diagnosed with mental illness. We tend to think that they can't be depressed because they're mncane. And there is nothing that's actually further from the truth. So a lot of parents, by the time they bring their kids to us, the child is now 15, 16, 17. They've tried everything outside of medical intervention. Community has beaten them up because we are Ghana, this and this. But all of those things are communicating with you something is not okay with the child. So as much as we are aware of the ways that our bodies communicate to us that we are not okay, we also need to be aware of how our children communicate to us they're not okay. It's not always a person just being, being a teenager or being a naughty child. Sometimes to not want to go to school. It's not just it's not always just the child being lazy. The child is only. It's important as parents and also as Black people for us to understand that children can be ill, and it's important to be aware, to not put them aside, to be aware so that you can access health care for them. I really prefer rather sooner than later. Children they really respond to early intervention. You don't want to find a child now presents as an adult, because at that point it's so much more complicated. So I really encourage us to pay attention to our children and to pay attention to our mindsets concerning all these things that I've mentioned.
Sure. Wow. You said we must change our language, and we must also change our belief around this thing. It's not that a person is being bewitched, or as Mama Yila said as well, that around spirituality, there's a concept that someone une demon, as an example. So there are a whole lot of issues that you are saying, hey guys, we need to change the beliefs. We need to change our language, how we communicate around these things. And the last one you mentioned also so powerful. I mean, we grew up hearing ukuthi, how can you say you are stressed when you are such a child? What problems do you have? And as Mama Ila says as well, sometimes it would go to an extent of being given a hiding, and maybe it's not all the cases, but maybe also the fear sometimes may stem from there, because you think about voicing how you feel, that lately I can't remember things, lately I feel like I'm stressed, something is wrong. And the first emotion that's attached to you voicing that out is your mother or your father saying Zokshaya and beating you for that particular. Maybe also the damage happens at childhood and parenting level, eh?
Yes, definitely. A lot of times, and I mean, I don't have the exact statistics, but from my practice, when I engage with my patients, we always want to go back to childhood, and there's a lot of things that take place in the formative years. There's a lot of things in the way that you attend to their feelings, that is communicating something to them. Because remember, the child is, for them, you are the voice. You are the voice of truth. You are the voice of authority. That young brain is unable to integrate or decipher what is true and what is not. Anything that comes out of you is true. So the moment you speak, you are laying a foundation for them. So you find a lot of adults or really broken children who are not attended to, and then now it starts manifesting. And that's why we start seeing a lot of mental illness start manifesting your late teens, early 20s, because now you're starting to see the effects of a broken childhood. So you can see that it's so misdirected when we say children don't get affected. Maybe kids are not expressing stress is because they don't have the vocabulary, firstly. Also, their brains are not developed to the point where they're able to identify their emotions. So they can't say, I'm feeling anxious or I'm feeling whatever. So they act out. But now, as an 18 or a 21-year-old, you're now verbalizing. The difference is that at that now you're a more complicated child because you're a child who has more years of all of that trauma. So it really stems from the things that we do to the children, the things that we say, the things that we emulate. I want to mention something so important as well. What you are as a parent as well. It's so incredibly important. If you are a parent who hasn't learned how to regulate their own emotions, who hasn't been able to identify their own dysfunctional behavior, you may think that you are creating a certain environment from your child, but your child is absorbing. Your child is learning that to cry is not okay. Your child is learning the only way to express power as a man is through anger. Your child is learning through your behavior. So you may think that no, maybe I'm speaking well to my child, but your actions are communicating something to your child. So I really also encourage parents that taking care of your well-being is responsible. It's being very responsible towards your child. When you decide that you're going to go to that therapist and you feel guilty because you're leaving your child, no, you're being responsible because you're teaching your child that when I'm not well, I'm going to find help. So you're going to have an adult who's able to say, if I'm struggling, I'm going to go and seek help. There's so much that we do as adults in children's lives, and there's so much that we can do better.
Sure. So there's a lot of generational trauma that we are dealing with, from a grandparent that had this and did not have the language and also was afraid of the stereotype. And then your parents did not know better. This is how they grew up. And now you are in the same boat. And as Upopi is saying, it needs to stop with us. We might have not come from mental wholeness and wellness where we come from, but our children doesn't also have to grow up in the same environment. So I'm raising my hand, and I hope the people that are watching are also raising their hands and saying, you know what, it stops with me. It stops here in terms of my bloodline and my generation. Faith, I'd like to ask you 2 more questions, and then we go to questions, right? Is that okay with you?
Perfect.
Great stuff. Now, my second last question, hopefully I'm not doing that pastoral thing, Guti, because you're speaking so well and you're sparking a lot of questions. But anyway, my question is, we've heard everything, and I think it's also Poppy's question. Where do we start? And I'd love the simplest way to start, because I think for a lot of us, it can get overwhelming. I mean, the fact that by itself you are struggling, it's overwhelming enough. And you watch videos on YouTube and you're just being bombarded with more. What's the simplest, easiest way to just start,
For me, it's listen. Listen to your body, listen to yourself. The world is very loud, and the louder the world is, even mental health advocates, even all of that can be very loud because we're saying this. So I would really say that take the time to be very intentional about listening to what your body is communicating. And that's not going to be a one-day thing. That's going to require you to be very specific. If it means setting aside 1 hour in a day, if it means setting aside, if you can't, setting aside 15 minutes, you're going to be in your space and you're going to listen. Because when you listen, that's when you start being able to identify. I can give you a whole list of things that mental illness can be. Some you can identify with, some you can't. But I tell you that there's a lot that your body can communicate to you. The moment you're able to sit and listen and document, listen, identify, what is this? Wait, all of a sudden, I'm finding that I have a pain here and I've been having this pain, but I've been ignoring it. Let me listen. Are there certain thoughts when I spend time alone? Are there certain thoughts that keep coming back? Don't ignore those thoughts. They're saying something. Listen. So for me, start with listening and being intentional about it. Don't do it one day. Don't do it 2 days. I tell you that you need your attention. You need your attention
Sure.
extremely. You need to show up for you because you are attentive to everything else. You're attentive to social media. You're attentive to your boss. You're attentive to your friends. You're attentive to everyone else. You need you. That's the first step. Attend to yourself. Listen attentively. And I tell you that the moment you're there, you have, write it down. That will then inform your next step.
Sure. Faith, that's so powerful. You need your attention. We give attention to so many things and so many other people as if we don't need our own attention. And when you said that, I saw it as a pie, and that this pie is the attention pie. And I'm giving slices to everyone as if I do not need a piece of attention myself. That's sure. Yeah. Wow. All right. Okay. So, yeah, no, this has been one of the best weeks, and thank you so much. I am learning because I have to say, there are certain things I'm experiencing in my body, and now that you mention it, I can think, because of writing the book, I've been sitting and writing and having sleepless nights, and I've been having pains that I don't understand, but I'm like, I'll just walk it off, I'll be okay, I'll exercise. And maybe the problem is not really on the body, that's a referred pain from the stress of not sleeping and everything else. So this is so powerful. Now, before we go to the questions, my question to you is, if we ended this particular conversation here, what do you think would have still been left unsaid? Is there anything that you would have prepared that you would still like to share? I'd like to give you a moment to say, hey, this is also important. I don't want to leave it out. Please just speak freely.
Thank you. So, mental intervention, right? It's not just, a lot of people can become very reluctant to access. Maybe you're afraid of going to the doctor. And I'm so aware of how fearful that process can be. But that doesn't mean that you need to sit on it. So there's a whole lot of, we call it the biopsychosocial approach. So biological, psychological, and social. There are people who are there. There are resources that are there to be able to help you. So if you're at a point where you're still struggling to be able to access, let's say you're still struggling, maybe you had a bad experience with the doctor and you're still afraid, you can then go and access a psychologist. If maybe you found that you struggled with a psychologist, you're not ready to do that, you can go and find a social worker within your community who can help you with some of the social stresses that you're encountering. If you find that you're not able to do that, engage with a life coach. There are so many avenues, especially now, that exist. And also within therapy, there's so much. There's the therapy that you can experience with the psychologist. There's art therapy. There's movement therapy. There's music therapy. There's so much that exists out there for people who are struggling with mental illness. And it's not there for special people. It's there for you. It's just about equipping yourself with the knowledge, equipping yourself with with the skills and the tools that would best fit you. So I say that just because therapy didn't work for you doesn't mean something else won't work for you. So take the time to explore, take the time to seek us out. There are, even though you may have had a bad experience with the healthcare fraternity, which is a reality, there are people out there who will be relevant to you. Don't give up on yourself because of a bad experience. A bad experience does not mean it's the end. A bad experience just means that didn't work. So just find something else that works. So essentially it's that. There's a lot. There's a lot that is out there. There are many people who are wanting to serve you. Don't sit on your mental illness. Take steps. Listen to yourself. Identify. And I think another thing is it's not nearly as scary as what it looks like, especially when you have support. Support from your clinician, support from your life coach, support from your therapist. You have a range of people that are there to support you. So it's not nearly as scary as when it is when you're alone. So get help and get it as soon. And I truly, truly vouch for space. I vouch for it. And it's just a matter of finding what best fits you.
Sure. I like that. I like that. So step one, listen. Just listen to yourself, give yourself attention. And then from there, you are saying to us, find help. And help doesn't have to be the same for everyone. We all like different things and we all have negative experiences with different things. So if you have trauma with counseling, for example, then try something else. And I like that because for me, and I'm being honest, you know, I'm confessing my sins, confess yours. I'm being honest to say, I just thought, hey, if you are not well, it's either counseling or psychiatry, and that's all, and that's it. And you are saying there are many avenues. Find the one that helps you, just like, you know, taking your car somewhere. If you're not happy with this mechanic, you take it elsewhere. You find something that works. And yet the most important vessel and vehicle of your life, you just want to give up, take it to one person and you say this doesn't work or that doesn't work. So yeah, thank you so much for that. Let's go to questions. Are you ready?
Yes.
All right. So Mama Ila is asking, says, can we speak about mental illness and spirituality? Oh, Mama Ila, that one. Says, some have said depression is just a spirit or a demon that just needs to be cast out. So he puts a question mark. Can you comment on that?
Definitely. So within the mental health space, spirituality is definitely something that we do consider, and we really have regard for everyone's, you know, spiritual beliefs. So remember that we deal with various. So I am a Christian. Those are my beliefs. But there are times where my patient is a Muslim, and there are times where, you know, people believe in ancestral, you know, spirits and all of that. So medicine says that I need to acknowledge that. But it's also important to be able to identify then when certain things are just above or just outside of the spiritual practice. So at times you may find then that our patients, for example, people who have a calling, so they think, no, we lose. But then once it's outside of the cultural beliefs, right, according to medicine, and they come to us, that's when you start being able to identify, this is a mental illness. So I want to first highlight that we do not at any point sideline or disregard people's experience. That is something that is valid and something that we're not going to exclude. So an important thing though to recognize is then, when people say, some people say depression is a demon. And a lot of those beliefs, and it's important for us to identify that, can stem from not understanding, right? I'm not here in my capacity as a spiritual leader or anything like that. So I won't say too much on the spiritual aspect of how certain things can manifest. But now I'm going to say, because of not understanding, because of not, having adequate information, people developed certain explanations for certain things that they weren't able to truly understand. And therefore, you find, there's then these beliefs, it's a demon. Whereas it may not necessarily be a demon, it's a person who's struggling with a mental illness. You find we give them medication, they're able to get better. So it's important to be aware of these misconceptions because it can prolong people's ability to access health care. It's important that even though we practice our spirituality, we are responsible with it. We don't find ourselves making people or disadvantaging people from getting the treatment that they need because we want to hold so steadfastly on our treatment. So yes, pray for your individual, trust in God, have your beliefs, but don't disadvantage them. And also just the importance of the fact that healthcare practitioners, any other professionals, are placed here by God. I am placed here to serve by God. So I'm having to be responsible with my calling, I'm having to be responsible with my role. So it's important to be aware of that as well, that the healing can come through the medical fraternity because now corner it's been placed in order to serve people. So I think my parting words are that yes, there's spiritual beliefs, yes, there's also medicine, and sometimes they may overlap. But the important thing is for us or for spiritual leaders and us as believers to be responsible in how we practice our spirituality. And it's also important for us as medical practitioners to be responsible in how we practice our medicine. And therefore, there won't necessarily be a clash, but everything will be to benefit the individual who is there, who is ill. Because when I treat you, as I said from the beginning, when I want you to be well, I'm not going to isolate your spirituality. One of the management principles is I want to know where you fellowship, what your spiritual beliefs are, because I recognize how much of a role spirituality plays. But we need to make sure that it doesn't become a disadvantage it doesn't disadvantage someone from getting the care that they need.
All right, that's wonderful. That's wonderful. By the way, Mama Ila, tomorrow we have Prophet Lebogang Lebelwan who will be asking her on the spiritual side as well tomorrow. So we are looking forward. But this is wonderfully said, wonderfully said. So Upopi asked to say, Uguti, can mental health be hereditary?
Yes, 100% it can.
Okay.
A lot of disorders are hereditary. Hence, it's so important for families to communicate. So you find that whenever I assess, we do a full assessment. I want to know if there's anyone in your family who ever had a mental illness. If there's anyone in your paternal family as well as your maternal family. Therefore, it's important for you to know, because if you know that, you then are able to understand your risk factors. I'll give you an example. You have weed. So weed is something that is used by people, and the government has made it legal. Right? For people to use in their own private spaces. But there are certain people who are more at risk the moment they smoke weed because of a mental illness gene that they have. The moment they smoke weed, they get then what we call psychosis. They start seeing things, they start hearing voices. So if you are not aware that you have that gene, you're going to find yourself then complicating with that. Unfortunately, there's no way that we can assess whether a person has that gene or not. But then your family history communicates. If there's someone in your family who had schizophrenia or anything of that sort, if you're using the substance, not only are you affecting your wellness, your physical health, because there's already those complications, but there's also the psychiatric, where you could find yourself being diagnosed with a mental illness at a very early age and even getting complicated because of that. So it's so important, especially, again, I'm going to go back to us as Black people. We don't like talking, or we don't want to say this and it's such a disadvantage, because then you're unable to elicit certain risk factors that you may identify, that you may have, and then find yourself complicating at the age of 20, 21, not sure what's happening, where it's something that was in your line. And it's important for people to know this, because people can easily blame themselves. Sometimes it's literally just genetically you're more predisposed to have this illness, and therefore when it comes, we manage it. So essentially it's a huge thing. Hereditary, I mean, genetics and it being hereditary is something that is very significant in mental illness, is something to be very much aware of.
Sure. That's powerful. That's powerful. You know what you mentioned, Tuguti, you can have this in your genes, and then by smoking marijuana, for example, you activate something and now you respond differently to other people. And you just reminded me of something Dr. Barbara O'Neill says. You know, she loves saying that genes cock the gun, but lifestyle pulls the trigger. And I love that, to say there are certain lifestyles that pull the trigger from our genes. You know, a whole lot of us have different genes that have different issues, but we also need to know those genes so that we are not constantly pulling the trigger and blaming our genes and the past. So yeah, that's so wonderful. Dr. Faith, thank you so much. It's been a blessing having you here. You've been wonderful. People have definitely enjoyed this. They say so liberating. Jefferson says so liberating. Poppy says, I love this. You know, Mama Ila has eyes on it saying so hectic. And before I let you go, this is a challenge after all. So we were challenged yesterday to go on a social media or gadget fast. So we need to do a 6 a.m. to 6 p.m. fast. I don't know how we will do it, because we went crazy when Meta went offline for 30 minutes or so. But we will do that. Sorry, you said we don't use that language. I'll deal with that. So, what's the challenge you are giving us today?
My challenge is to listen. So, for the next week or two, I'd like you to please dedicate at least 30 minutes where you're going to spend time with yourself. So it's good because you mentioned the social media. So it
Yes.
actually is, because you need to remove all forms of distractions. You need to remove anything that may make a noise, anything that might, you know, take any of your attention. For those 30 minutes, it's going to be time to listen to yourself. Maybe take a book, for people who like journaling. If you don't like journaling, you're more than welcome to just be alone in your own space. But my challenge is to listen. Find what you are saying to yourself. And I tell you that there's a lot that you're going to realize you've been saying, but you haven't been hearing. So essentially, I challenge you to listen 30 minutes a day. For the ones who are ambitious, 1 hour.
Sure.
Yeah.
Yeah, we've been challenged, we've been edified, we've been shifted. Thank you so much. You've been a blessing. I will chat to you sometimes tomorrow. So have a blessed evening. Thank you so much.
Thank you so much.
Well, family, it's been a blessing. It's been a blast. If you were blessed, and I'd just like to ask you to do me a favor. Please share this. There are so many people that needs this message. Just pay it forward and share it to them. And also, if you were blessed and would like to give so that we can keep going and so that we can keep the lights on for you, please do that. I will share the banking details as well. Other than that, stay blessed by the best. And hey, spend some time listening. Bye-bye.